I've been studying the public debate on this emergency since the very beginning, because we started in the end of January, and and this evolution is pretty interesting, and it's also really interesting. For the things that Neil was saying before, so for the fact that this is really something that is touching everyone in our daily lives, and the debate that is going around COVID is particular, and in February, the World Health Organization coined this new term, the infodemic, talking about information regarding this emergency. So infodemic refers to the widespreading of lots of information on COVID-19, and this information is often unverified, unreliable. So the problem is that it can destabilize the public opinion, the public perception, and can make it difficult to form an opinion, but especially to form a clear opinion on the subject. And what's the risk of the infodemic, and why the World Health Organization stressed this with the advent of the pandemic? The risk is that if you have all this information that is going out and people that are not able really to understand what's happening and how they can react, and they should react to also to help the community. So the problem is that you can also have an impact on the epidemic process, and you can fragment the social response. So for example, in Italy, we had this very nice example in this direction, that was the fact that lots of news outlets anticipated the news on the lockdown in the beginning of March, the lockdown in the northern Italy. And so lots of people left the northern regions towards the south, because they heard about the lockdown before the president, our president, was talking about and was presenting the decree. So indeed, the population was not understanding what was happening, what was the aim of the lockdown, and in the end what we obtained was that people just, they spread the disease also in other regions, and this was exactly what the lockdown was going to prevent. But the communication was not happening in the, let's say, the right way, in the sense that people were not informed, and also newspapers had in this great responsibility of anticipating some news before the official communication. So of course it's important to understand how people get informed, how they form their opinion, and how this can influence their choice. Because in this way we can understand if what we are trying to recommend and to ask people to do is indeed and can indeed working in the end. So this is a really important aspect, especially during a pandemic, to establish, to establish a direct communication and a link and an exchange, I would say, with the population, in order to let the population be aware of what's happening, what, in this case, for example, the government is doing to prevent the disease spreading, and what everyone can do to help the community going out of the emergency. So of course, in this context, it's really, really important to give people high quality information, because they need high quality information to understand what's happening, and how they can react properly. And this is not what we often can observe, let's say in general, and I can talk specifically for social media and in general for the online environment, because the quality is often poor. And this is not only a problem of misinformation, because misinformation in our studies and in our works in this period is something like below the 5%. So it's not, in my opinion, it's not the problem is not only misinformation. This problem in this period and in this context, the problem is that we have lots of information also coming from newspapers. So let's say official news sources that is often not complete, that is sometimes unreliable, because the matter is very complex. And we have to, and there is lots of uncertainty. The problem with the uncertainty is that you have to try to communicate this uncertainty to the public. And I really think that this is a crucial keyword in this pandemic, and especially for the communication process, because of course, people are asking for very precise answers, and you don't have these answers right now because you're still studying. So, of course, even the role of science communication can change during the emergency. Erika, are you speaking, because I'm not hearing you?
Sorry.
Okay.
Have you seen the same pattern also in other countries, or is it typical Italian, this lack of and gaps in the institutional communication?
Well, we are focusing on Italy now because we're really interested to understand what's happening here. But I mean, it's not a matter of only on the institutional communication. It's just, you know, the whole context. So what's happening in the whole context? It's really difficult, because you also have to consider the business models, for example, especially online, for newspapers that are online and want to be there. But of course, they have to adapt to the business model that you have online. So to produce content and to give content to people and so on. So the problem is that, of course, so you cannot, so science is not perfect and is not able to give precise answers now. So it's not foolproof, you know, and we need time, and scientists need time to understand what's happening, understand this virus, understand how they can, for example, try to stop the disease and the spreading. But of course, we need time, and we need, and experts in the fields need to discuss and to agree. So they have to converge in the end towards an agreement. And so the problem is that one single study is not enough, of course, because it's just a singularity, so, and cannot be taken as a solid scientific evidence. And this is often the problem, because lots of these studies that are just hypotheses, I would say, being tested by research groups or whatever, they're just, you know, single studies, and they're not really showing any solid and final results, but they're not always communicated as such by journalists. And so there is a problem, because especially in this period, we have lots of papers, so scientific papers and scientific production that is going online without a peer review process, like it's usual. So we have to be careful when we are communicating, because otherwise, so if you don't if you're not able to explain how science works, and the uncertainty that is linked to all the process, it's also difficult to explain in the end to people why you don't have exact answers today, and why you cannot be very sure. So you are making some attempts, and you hope that these attempts will be the right ones. But so of course this is an, I guess, really in a challenge for science communicators, because in this context you cannot rely on accuracy and on facts, which is usually what you usually, so a science communicator usually do. So presents the most solid scientific evidences for the subject. So in this context, you cannot do this, because what we know today, maybe tomorrow will be proven wrong. And you have to communicate this uncertainty to people. So to let people understand how science works, what's the process behind, and then you also have to consider what's happening when people select information, how they select information, and the cognitive mechanisms and biases that are behind this information selection, and and also how people interpret information. So of course this is not really an easy task, and so it's you know it's a challenge. It's a real challenge now that we have, but I also think that can be an opportunity to evaluate this communication exchange with the public, and how we can try to improve this to try to answer people's doubts and questions and concerns about this pandemic.
Yeah, and does the role of science communicators then change in time of emergency?
Well, yeah, it changes exactly for these reasons, because of course you also, the science communicator has to deal with this uncertainty. And so, of course, it's really a matter of explaining how things work, and why it's also good not to have the right answer now, because it just, so we have lots of scientists that are working in that direction, and so, and we're also working a lot. I mean, so lots of it's just a matter of let this process passing, because otherwise you can sometimes, especially in the past and especially in Italy, there was this message coming from science of something like, really dogmatic, science is the truth. And so, of course, if you communicate science in this way, then you can have very bad side effects, like now, when, of course, you have lots of uncertainty that is going on, and then you have to explain people why the science that you are promoting as perfect and as the mean for giving exact answers now is not working anymore. I mean, it's just, a way of understanding that you have also to give people this concept, to pass this concept to the public, so that it's easier to understand why we have to go on using, making attempts and evaluating all of these steps and understanding if they are working or not.
Yeah, it's sort of a scientific method on science communication, in a way, of trials and errors and attempts.
Yes, it's I mean, on a side it's a scientific, so it's explaining how the scientific method work, and how also the science community usually work. So and on the other side is also to give people, the tools to be aware also of the mechanisms that are behind information consumption, but at the same time also to foster people to use critical thinking, because so this is something that indeed we were already seeing before the pandemic. So we were already working in this direction, and I think that this is sadly, I would say, this is really the example, the context where everything is happening now, because of course you have to provide people with tools so that they are independent and they can know what to look for, how to interpret information, and to understand what's happening.
Okay, we have a couple of questions from Christine. One is, do you know any examples of good science communication that expresses uncertainty?
This is, well, in Italy, I would say that, because I know now much better the Italian context, because I'm really focusing on this in these weeks. But in Italy, we had very good examples of science communicators that were able to explain this. And okay, we have and she's also working for Ca' Foscari because she's involved in our science communication project. So for example, Roberta Villa, she's a journalist, a scientific journalist, and she's doing great communication on this emergency since the starting, so since January. And I'm also working together with a group, with an association of science communicators here in Italy in this project where it's a sort of interdisciplinary research group where we meet together. And so I come from the academy like other members, but some of them are just science communicators. And so it's a heterogeneous group of people, and they are producing in this period some content on the pandemic to explain what's happening, also to explaining what's the information scenery, and also what's uncertainty. So yesterday they published this video with that. So there is a comedian that is trying to explain uncertainty related to, in general, to science, and so there are many ways and different ways in which you can try to reach people. They decided to use the stand-up comedy to do that, so to find a new way of trying to reaching the public.
Again, Christine, she writes, it has been interesting here in Scandinavia. I am based in Denmark, and all decisions are seen in light of Sweden's very different strategies. People want to know what information politicians are using to make these decisions, and why is it so different? So Christine, if you want maybe to help us understand.
So I don't know what the protocols are of like talking.
Okay. Oh yeah. We're free. Super free.
It was more of just a comment that this is an issue we're grappling with here. In the Scandinavian context, it's a little bit different because I think people trust the state so inherently to give them the correct information. It's very kind of cultural that they'll look at whatever the government says, and that is what the answer is. But both Sweden and Denmark have that in common with each other, and yet they've taken very different approaches. And I can sort of see in the environment around me that that's really difficult for people to like grasp the disparity of that. How could, if they're looking at the science, as you say, the true science, how could they possibly be making these sort of different decisions? And I'm involved in a film project here at the Medical Museum where I'm based, where we're trying to grapple with a lot of the questions you're bringing up. So I guess it was more just a comment. That's a question I'm more asking myself. How am I going to explain that to people trying to get into like models and modeling and maths, and how do you even, maybe if you had any sort of tips or insights, if you're starting with explaining data science on like a public, like how do you even begin to broach the conversation of the way data science happens?
Well, yeah, and this is an interesting comment, because you mentioned trust, and this is exactly, and this is the other keyword because it goes with the uncertainty. So it's the problem that we have in Italy, and it's also what now science communicators can try to do, so to regain trust, because it's also the lack of trust that can push people to look for alternative information sources, and so to, for example, engage with misinformation, disinformation content. So in this direction, trust is really something that, of course, it's not easy. And here in Italy, I think that the contexts are different, because we don't have this experience of this high trust in the institutions and in the government, and so people want to understand what's happening behind But I mean, I guess that this is really crucial during a pandemic like the one that we are living. So to let people understand and what's behind the choices that you are taking, because I think that this is something that in Italy has been missing in these first months. So what you get is sometimes that you don't really understand what's the aim, for example, of this very strict lockdown. So I think that it's important to give these messages to the people, if you want, especially, for example, now here where we are living in this very strict lockdown measures, and this is going on. So this has been going on for a lot. I mean, I'm at home since the last week of February, so it's more than 2 months now, and of course it's not easy. So also letting people understand why this is necessary, I believe this is really important. Then of course there is the other side. So how we can very complex messages arrive to the people, and this is the other challenge of this emergency, because I mean it's a really, you have to communicate the complexity and uncertainty at the same time, making it as much as simple as possible to let people understand. So it's not easy. We're trying to understand what can help and be better.
And how can data science help in this emergency? Well, first of all, if you should tell in one sentence what data science is for someone who doesn't know.
Yeah. Well, data science is let's say analyzing the data to reveal patterns, and that interesting patterns and useful patterns that can be that can help in finding the right let's say decision in the end. So can help the decision process. So what we are, for example, doing now, we are trying to map the information system to understand what's happening, what are, for example, news sources talking about how people are reacting to this content, what people are looking for, and what in the end they are getting as a result. What's the content that is covered by misinformation sources? So also to understand maybe where it's more important to stress institutional communication and to give clear messages to the population. So of course you can have a much clearer idea of what's happening because you're working with lots of data. And for example, so I'm involved in the task force with Agicom, which is the Italian authority for the communication. And it's a task force of data scientists. So we are working with data to understand this. And today we released our first report online. So it's an interactive report where you can see a bit what's happening online. So, for example, what's the percentage of content that is dedicated to coronavirus, or what's the percentage of content of posts, for example, made by misinformation sources and whatever. And so, of course, this can help in understanding what's happening, and can also help in adapting the communication strategies, in understanding, for example, if what you are doing today is indeed working. So, for example, is engaging with people. Because an interesting result that we had is that if we look in Italy at the scientific sources on online social media, what we see, so if you look at the trends, you can see that since the starting of the pandemic, we observed an increasing in the production of content on, of course, on COVID-19. And this content, starting from the end of February, is becoming more and more engaging for lots of sources. So it's the content and that is able to attract more attention from the users. And this is not surprising, of course, because this is a really interesting topic. But what is surprising is that this is not happening for two categories of news sources, and one of these is scientific sources. So during the pandemic, well, you would expect people to look for information, for scientific information in scientific sources. What's happening is that people are just relying on other kind of information that is coming from, for example, from newspapers or from TVs. Even online, I mean on online social media, through their Facebook pages or Twitter accounts. So I mean, I guess that this is something that, of course, we have to take into account if we want to improve, and so to understand what's, for example, what's missing in the scientific communication now, so that people are not so engaging with scientific content, but are relying on other kinds of content. And maybe the answer cannot be so nice. So can be that people just look for very, neat solutions, neat answers, and so on. But I guess that we can try to adapt. So to, let's say, to intercept these needs, and so maybe to change our communication accordingly. And this is also the what we are trying to do. So yeah, in Italy we have lots of task forces in this period. I'm also involved in one that was in one that is specific on misinformation and information spreading on COVID-19 with the government. And so, yeah, the idea is to using the data that we are analyzing, so the results and what we can observe, and to use this information to try to improve also the institutional communication, so that we can try to answer the needs of the population and try to improve the overall quality of the information on COVID-19.
And do you think that the study you are doing, you and all the task force and your colleagues on science communication on this coronavirus might be useful also for the climate crisis, for example, which is as important as the health issues that we are dealing now, but that is not having the same same importance in a way?
Yes, I think so. Yeah, of course, this is so this pandemic is really touching everyone, and also you could say, well, even climate change will touch everyone, but it's touching everyone today. So I mean that this is really a crucial point here, because of course when your life is completely changing because of this, and the answer that you're looking for is in science, so maybe this is also an opportunity for science to emerge, and for scientific communication to try also to use then the same leverages for other topics like climate change. But I think that this pandemic can really show us what was missing before in the scientific communication, and now scientists also were communicating outside the academia. And I believe that climate change is really, one of the most emblematic topic in this way, because it's a really huge issue that we have, and we know about climate change since many years now, but indeed there was no social response on the topic. It was not perceived as an urgent matter. So maybe we can learn from this pandemic. I hope it will end soon, but I also hope that we can learn something from this pandemic.
Yeah, so we have time for a couple of questions if someone who is attending does have any question.
What's kind of been confusing me about this whole, especially about science communication during this whole pandemic, is that the governments seem to be very reluctant to give out, lots of information, basically, meaning that it's clear that they communicate that they're, assimilating lots of information, that they are collecting information, that they have a good handle on the, on the figures, on the numbers and everything. But they communicate very, very little. I mean, even in the span of a 2-hour press conference or something like that, there'll be very little communicated about how actually decisions are being made and stuff like that. And what I'm wondering is, and yet we see from the news and from, journals and things like that, we see that the amount of information being published about this pandemic is more than has ever been published, about any crisis, in the history of science communication, basically. So what I'm wondering is, why is there such a disconnect between what we're hearing from the authorities in terms of, pure information? Is that an intentional effort by them to control the narrative? But is that leaving, and if it is that leaving space for, let's say, less qualified people to fill in, how decisions are being made? And I mean, what do you feel is behind this kind of disparity in the level of information that we're getting from the government versus from news and other sources?
Well, I don't have the answer, but I can have, so it's my opinion. I guess it can be a combination of factors. So one factor can be maybe the trust. So if you trust the population to understand what's happening and what, so maybe this can be a factor. The other one, I guess it's much more political. I mean, since you don't have, the right, indeed, you don't know now what's the best choice. You are making simulations. You are trying to predict, but of course you are. So in Italy we had this example. I guess last week where politicians asked the science to give exact answers, and of course the answer that you're getting from science is we cannot, because we don't know enough now to give you exact answers. And so it's also a responsibility of the political class then to act and to make choices. And I think that since this is a very extraordinary event, and it's something that we never experienced, it's also a matter of fear, so of not understanding what's the best way of managing the crisis, and what the reaction of the population would be when everything is clear. And for example, maybe it can also be just, you know, fear of spreading panic when you know that indeed the choices that you are doing are not so straightforward, because you are also you're trying to do your best, but you don't know what will happen, so everything will be and so I think this is honestly, I don't think it's so easy. So I wouldn't be in a political position now, not really, because it can be really difficult to make choices like that. So I don't know. Yeah, I don't know the answers, but I mean, of course, there is. So there is a political side, and I guess that the aim of science communicators is also a bit different than that of the institutional communication, of course. But I guess that in this case, it can be sort of assist, you know, it can complement the institutional communication to try to explain what's behind some choices, because sometimes these choices are not intuitive, but in the end there is a solid reason behind this choice. So sometimes it's just a matter of explaining what's behind.
Thank you, Fabiana.
That actually makes me think of a kind of a follow-up, which is that I've also noticed that it seems like there is a real lack of communication on the part of, you know, science communicators about not about how the coronavirus works. I mean, we've heard ad infinitum about, you know, about the spike proteins and about stuff like that, and about the medical treatments and that kind of thing. But there was, I found something on Twitter at one point, which was just like a really simple animation of just like little balls, basically, you know, and it essentially just did a random path kind of, you know, sort of pinball, you know, style, essentially analysis, right? Of if you just have a big rectangle and you have a bunch of balls, which each one is a person, and then you let them just randomly walk, you know, as if they're just going about society. And you see how often they bump into each other, and then how often that spreads the infection, you know, right? And then you just freeze like half of them and do the same thing again, and you see how the lack of mobility has like a direct effect on how fast it, you know, I mean, it was like the most simple but brilliant explanation of why you need people to stay at home. You know, it like explained more than, you know, volumes of text about that. And I think it was published by the Washington Post. And after I saw that online, I thought, oh, this is going to be easy to find later. And I've gone online and I cannot find it, you know. And it's shocking to me that nobody else has produced something of a similarly digestible nature. And so it seems like a lot of the science communication either is on the really, really low end, meaning almost like propaganda, you know, like political, or on the quite high end, you know, being really, really detailed stuff about, you know, about the disease and about the studies. But I see very little trying to explain to people just why these measures are being chosen and things like that. But from a technical or scientific perspective, do you have any thoughts on why that might be the case, or do you have the same impression? I mean, maybe it's just me. Maybe I'm wrong. But
no, well, I mean, yes. So that's partially true. But I guess that in this, for this reasons, social media can be really, really a great opportunity, because at least for Italian science communicators, what I'm observing is that in Italy, especially on Instagram, you know, which is also a viewed platform, that because you can just think of Instagram something like very, you know, just for pictures and fashion and beauty stuff or whatever. And but it's really, so I guess maybe the concept behind this platform, so the idea that you are getting in touch with another person and you really feel that person very close to you, because you are looking at these stories, and now that we are in this pandemic, but even before, people are at home, so they're showing you their daily environment and all their daily life. And it's working, I mean, because you have this sort of direct contact with the public, and they can ask you questions, and you can answer these questions pretty instantly. And I also saw some contents like the one that you were mentioning from Italian science communicators there. I have also to say that they started before. I mean, their communication there was already based on the fact of giving people tools to understand how the scientific method works, and how you can also interpret the information that you're reading and whatever. So to give tools instead of the simple, fact-checking tool. And now that you are giving very basic explanations, for example, on how the virus, for example, on the R note, so how the virus spread and why it's important to keep this number very low, so that you are limiting the spread of the disease around. I mean, it's something that I am observing, but I think and I believe that so the challenge is also to try to engage with new platforms and new tools to reach also other targets. And of course, this is a challenge because it's not, but it's also, I mean, it's also, this is also something that I was saying before, also to journalists in general, before this emergency. So, I mean, if you want to stay online, you also have to understand, what are the rules of this or the mechanisms of this environment. But you can, if you understand the mechanism, maybe if you adapt, you can also offer good information and quality information and try to to stay in the environment in a new way. So it's maybe sometimes a matter of reinventing oneself.
We have two very interesting questions. One from Talitha from Science Gallery in Detroit. She asks, in your opinion, could art and creativity help in communicating science communication efforts? If so, do you have any examples of science communication that used art to explain a message, like the video that Neil talked about before?
Okay, yes. So my answer is yes. So I do think that art and creativity can help. Now, I don't have any examples coming in my mind rather than the video that I was telling you before, because there is a comedian. So of course it's art in the sense, yeah, of, but I mean, there is this comedian that is trying to explain. So you are using a different approach to explain that the video is about epidemiology. So to explain the process and what's behind, and also the art note and whatever. And so I do think that this is something that it's worth pushing and trying, because I think it can work. I mean, it's also the concept behind Science Gallery. So
yeah, exactly.
can give much more examples than me in this direction.
And then Christine again, I wondered whether science communication in Italy is done exclusively in Italian. How might this affect more marginal communities who don't speak the majority language or don't speak it well? It's true.
Yeah, that this is true. It's made much exclusively in Italian. So I know this is a problem. This is something that we already took in consideration on the research side. I mean, so we will see if we have maybe we will have some news in the future. But of course, making science communication inclusive is another problem. So for example, I know that here in Venice there is this very big Bangladesh community, and it was very difficult for the mediators to explain what was happening. So during this emergency, and to explain the lockdown and what was behind, because there was no word, for example, in their language for the virus. So it was really, completely a new challenge, and for the communicators and the mediators. So of course, this is something that is worth investigating, and also so to make science communication more inclusive, especially in a context like the one of a pandemic, where of course you should try to include all the population in the communication on the disease and the spreading of the disease.
Federica asked, the problem of science communication seems to be addressable on two sides. One side is the actual communication, in need to be able not to sacrifice complexity and uncertainty. And on the other side, there's how people receive and react to communication, as you said. What can be done for the latter? How can people learn to accept complexity and uncertainty?
Yeah, this is a $1 million question. My personal opinion, and what I'm really stressing, is that we have to work to give people tools to push them using the critical thinking, and to start from the education and from the schools. And this is something that we already did in the past. And I prefer this kind of let's say solutions to the ones where you just give people very just give people the answers, or a sort of checklist to follow, or fact-checking websites, because in that case I think that you're not really giving people the tools to understand what's happening and how they can reason, because I do not think that we have so I think that people can be free to look for the information that they want and that they need, and they have to be free to interpret and to select this information. But of course, we can work on making this interaction with the information much more solid, and so to explain people how they have, what are the aspects that they have to consider, for example, while reading an article, while evaluating research, and so on. So I think that this is really an important point. And then, of course, I don't know if in the end this can really help people in accept complexity and uncertainty, because then, of course, we are human beings, and complexity also comes, I guess, with a bunch of fear, and because you don't have things under control when you don't really understand every single aspect of what's happening. But I think that is something that it's worth trying. So to give people trust, I would give people trust to let them be independent and aware of the context.
Thank you very much, Fabiana. If there are no other answers, there is speculation of a second wave of COVID. Do you know what measures are being taken to reduce spread?
Well, it's a matter of social distancing, all the measures, and tracing, tracking, and there's a lot of talking now in Italy for this app that should be able to give an alert to all people that went in touch with someone who got infected. But I mean, this is really, so I guess that we will see these measures also changing in the next months according to what will happen. So don't really know.
Okay. Fine. So maybe if we don't have any more questions. Okay, so we can thank you so much, Fabiana, and thank you, everybody. Yes, here there is a Google form so that you can give us a feedback on our webinars and also subscribe to our newsletter. We'll keep on having webinars every 2 weeks. Thank you, Fabiana. Good luck. And one last question. Which newspaper do you read?
No, but in this period I don't have any time to read the newspaper. I have to be honest. But anyway, no, I'm reading a lot from the Post in Italy.
The Post.
Yes, now yes, I have to say that.
The only newspaper who did not give the news of the first. Yes. The first decree before it was officially declared.
Well, I think that they're doing a good job. Yeah, I can say this. But honestly, really, I don't have much time to read news in this period. No, I can say that I'm bored in this period. Not at all.
Okay. Thank you very much, Fabiana. Thank you, everybody.
Thank you for inviting
being there.
me. Thank you, everybody, for being here.
Grazie. Stay safe. Neil found something on the animations. Great. Yeah. You found the video in the end. You see?
Yeah. Well, no, I didn't actually find the video. I just found an article on it. Basically.
An article.
But yeah. It takes telling people you can't find something to actually then have it show up in your search results, which I'm sure is something with Google listening to you all the time and deciding when it's going to actually show you things that you search for.
Okay.
Interesting thing is that this little, I don't know what this zine is, but the article says that this was the most read Washington Post article ever. The one where he presented these simple simulations. Most viewed story ever published on the Washington Post, apparently. So I guess people do pay attention when they actually find it, but
Yeah. Okay. Thank you, everybody, and follow us on our social media.
Thanks, Fabiana.
Ciao Fabiana, grazie mille.
Grazie, ciao.
Ciao.